Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, this last week I've been a little bit on the struggle bus. I feel like I've talked about this before on the podcast. I have like these inner hecklers. This is like how my imposter syndrome, anxiety, and all this show up is I have like these inner hecklers. Honestly, I review them as like Statler and Waldorf in the back of my head, who are all, you're not good enough. You don't know what you're doing, blah, blah, blah. All the normal bullshit, right? Usually I'm pretty good at just like ignoring them and drowning them out. But the last week, for some reason, they were being extra loud and annoying and were getting to me. And so it was a little bit of a struggle. Now when I'm talking about this, I'm actually doing better. It was just a rough week. And, I just really tried to be open about these things because, I know I'm not the only person who goes through this. And I know we all struggle at times. And, it's nice to put it out there, one, so you're not alone. And it's always nice. And, I definitely had friends who I tweeted it and was just saying, Statler and Waldorf are being, extra loud right now. And it's distracting. And, the messages of love and support are always helpful. And they came just when they were needed. Like I said, nothing too bad. Just like the hecklers were being a little louder than usual. And I was on my way out, on my way through at that point, and it was really great to have people being like, no, seriously, that those voices are just being assholes. Like, just ignore them, tell them to go touch grass. And it was helpful. And I'm just really grateful for my support system and for just like all of my great friends. Because I just needed that little bit of like, dude, those voices are being ridiculous. Come on. And I do know those voices are being ridiculous, but sometimes they get loud and a little distracting. So I think I might just kind of end it there. I have kind of a long interview this week. It's really amazing, but it was a little long because we just had a lot to talk about. So let's go ahead and turn to the interview. I had a wonderful conversation with Liza Fuentes at the Guttmacher Institute. I have her on to talk about this great new paper she wrote talking about inequity and U.S. abortion rights and access, and that how post-Dobbs, that's only getting worse. And it's a really wonderful conversation. I hope you all enjoy it. So here is my conversation with Liza. Hi, Liza. Thank you so much for being here today.
Hi, thank you so much for having me on the podcast. It's really exciting to have this conversation, even if a little grim at the moment.
Yeah, we're recording this right after what would have been the 50th anniversary of Roe. And so it's kind of a heavy time to like think through all of the things at the moment.
Yes, for sure. I mean, yesterday it was just like a Sunday. I was doing my laundry, working out, and just thinking about what people in this country would have been thinking 50 years ago and what a difference it made for pregnant people, anyone who could have become pregnant at that time, people who had recently had abortions, and how much things have turned around. But also there are many ways in which, the landscape for abortion care and access is quite different. But as we'll talk about, the bigger infrastructures, the bigger structural determinants of health that organize, the privilege of healthcare access in this country, many of those things remain the same. And I think those are important narratives and facts to draw out if we want to continue to protect and advance abortion rights.
Okay, Let me catch myself before we get too excited and get talking.
Yeah.
Do you want to take a second and introduce yourself and include your pronouns?
Yes.
Because I have definitely done that before and forget to have people do introductions. So let's not do
Yeah.
that.
Thank you very much. My name is Liza Fuentes. I'm a senior research scientist at Guttmacher Institute. And Guttmacher Institute is a nonprofit organization based in New York City and Washington, D.C. And we work through public health and social science research, policy analysis, and public communications to advance sexual and reproductive rights in the United States and really throughout the world. Really taking the perspective that understanding people's experiences and looking at the science and facts around reproductive health is the key basis for forming policy. And my pronouns are she, her.
Thank you. Yeah, y'all are always my first go-to when I need some factoid or data or any number of things. Like Guttmacher is the first people I turn to.
Well, I'm really glad to hear that. And we're very thrilled to be of service to our colleagues in the movement who are really building so many of the arguments and doing so much of the organizing and storytelling around the key issues that we work on.
Okay, so let's turn to this amazing paper that you just put out talking about the inequalities or inequities in healthcare and in abortion specifically, and how the loss of Roe is going to exacerbate them. So maybe let's start at the very beginning, because it's a lot, and talk about some of the existing inequities in abortion access.
Yeah, well, that's an important point to start at, because I think if you're someone who really wants to understand more about what it means to overturn Roe and what we're looking at in the future, you might be looking around, especially social media or even the news, and see that people are talking about how the overturn of Roe is going to disproportionately have negative effects on certain communities, certain groups of people. And, for anyone who tracks health inequities and disparities, that's like really what we're talking about when we talk about health inequities, that health access to the resources to take care of oneself, to access health care, and then those health outcomes are not the same for different groups of people. And in particular, in the United States, we often are talking about race because race and racism is such an organizing principle of privilege in society. And we talk about income and wealth because access to those types of material resources are directly needed to access healthcare. So, just to get to your question, I wanted to give that background, right? Abortion is not
super
different.
Important context.
Yeah, abortion in many ways is not different from how we understand how health and well-being get distributed in society along lines of systems of oppression like racism and classism. And so the first thing to know is that even before Roe was overturned, we had inequities in abortion access. Not everyone who needed abortion care, or let me back up even further, not everyone who needs to be able to plan if, when, and under what circumstances to become pregnant and have children have the same resources to be able to do that. And that's been true for since the founding of this country. But understanding how that gets embedded in the way abortion access manifests is sort of one of the motivations that we had to write this paper. So, the very, very first thing is, what are the resources that people need to decide if, when, and how to become pregnant and give birth? And, in the paper, we highlight a couple of really primary examples. But, any range of things, including safe and affordable housing, communities that where people feel safe, where they have the resources to be in community, right? Spend time together safely, be able to access food and living wages, where they live. All of these things are foundational principles for general public health and the concept of reproductive justice, right? Which, this really invaluable framework that, frankly, Black women, scholars, and activists have been using for centuries in this country. But the term that came about in the 90s was that simply accessing contraception and healthcare is not adequate to describe the ways that our social structures are harming and failing to serve the health and well-being of communities of color, and particularly women of color. And so when we talk about reproductive justice, we talk about the foundational inequities by which people don't even have the ability, or at least the full ability, to be able to decide, if, when, and how to become pregnant. We highlight a couple of really key things that really have to do with healthcare access. So number one is income. And, that might seem obvious. Different people have different incomes because we have different jobs. But there is an economic justice framework that we have to look at, which is that there is a profound wage gap in this country by race and gender. And at the intersection of race and gender, we know that Black women and Latinas in particular earn wages that are half that of white men. So on the face of it, when we know that things like healthcare services, contraception, contraceptive devices, and methods cost money, we see that women of color are already in a position where they simply don't have the same level of resources. Income is just one example. And then we get into health insurance. Why does health insurance matter? Well, health insurance really is the dominant way that people access healthcare in the United States, of which family planning, contraception, and abortion, are part of those healthcare services. And women, and particularly Black and brown women, are much less likely to have any health insurance coverage at all, on the order of almost 50% to almost 2 times the proportion of white women that don't have health insurance. 23% of Latinas have no health insurance. 13% of Black women in this country of reproductive age have literally no health insurance. And we're talking about a time when we're 12 years out from the Affordable Care Act, which profoundly expanded healthcare access to many people. We still are living in a country where those gaps exist, and that the burdens are falling on Black and brown women. So then you just have a landscape where reproductive health from the very beginning, right? Sexual reproductive health is not enjoyed at the same level by different groups of people. And that background, I'm talking a lot, is important because the question often comes up about inequities in abortion in particular. People are incredibly interested in this, as they should be, right? Because first of all, we know historically that even when abortion is highly restricted, wealthy people, frankly, will always get abortion care. This is really well documented. And so when we talk about restricting abortion, including banning abortion, we're not really talking about taking away abortion access for an entire population. We're not really talking about a country coming together on a cultural and moral level and deciding that this is what we want. What we're talking about is carving out a world for people who don't have as many resources to be struggling to access abortion care and getting abortions later, or being denied abortion care, whereas wealthy people will always get that. And we know that that's the case. So the key part of this background is this, that for the very same reasons that particular communities in this country, and in the paper we highlight Black and brown women, Indigenous women, and people with low incomes, because we have the most data about those communities. But it's important to note that anyone who is denied the right, the dignity, and the resources to take care of themselves, take care of their sexual and reproductive health, including trans people, non-binary people, people living with disabilities, young people, anyone for whom who they are in this world interfaces with a policy that says you don't deserve to have the same rights and privileges as other people, are going to be in a very particular bind, which is we don't have the same access to resources and services to be able to plan whether or not we want to become pregnant and have children. And at the same time, we also, those same lack of resources make abortion inaccessible, right? So we may be more likely to need abortion, but at the same time, we may have greater burdens in accessing it, which means further delays in abortion care, abortion later than we wanted it, or maybe denied abortion care at all. And it's a wordy way to pull together a picture that a lot of people have a lot of questions about, which is if abortion rates are higher among Black, Indigenous, and Latina women, how can we say that they have less access to abortion? Because you have to look at the context in which the resources, the privilege, and the dignity to decide about pregnancy in general and parenting in general inform the story of being able to prevent pregnancy and obtain an abortion.
Yeah, I feel like a lot of antis interest in that data point really is like they get more abortions, full stop. And there's no like questioning of the like, okay, well, they have less access to contraception or more effective methods of contraception, or they don't have access to healthcare to even think about crossing that next step. They don't like take it back to the beginning and see how all the inequities started way before that moment.
Precisely. I mean, certainly not. And I'm not an anti, so I can't necessarily speak to motivation. But what I can say is that the fundamental, obvious, glaring gap that they have to leverage to even able to tell that story is for the dignity and autonomy of the person themselves being the central metric of whether or not their well-being is being served, right? So it's easy to say that, okay, abortion rates are higher among Black and Latino women, and then spin really sordid tales about what that could mean, including, really horrific things like saying that Black and brown women are targeted for abortion. But if you bring in the stories and the voices of people for whom they're making decisions about their body, that kind of it doesn't really hold water, right? Everyone should be able to decide for themselves with no coercion whether or not they want to become pregnant, and if they're pregnant, whether or not they want to have an abortion. But simplistically taking something like, abortion rates by race or by any other group of people and telling any tale about it without understanding the bigger picture means that, the humanity of the people we're talking about who represent those rates has to be erased. And that's what I think they're doing.
It was also interesting you brought up coercion a little bit, and thinking of another data point you talked about was more Black and brown people being pushed into using birth control or different methods of birth control, and like that is also a form of reproductive coercion that is put on that community.
For sure. I mean, again, to that point, I think even further that maybe we could have gone further in this paper, but we had to kind of, make it
Yeah.
readable within 15 minutes, is that certainly many people are pretty familiar, especially, who pay attention to these issues on a daily basis, are pretty familiar with well documented cases of immigrant women, brown women, Black women being subject to coercion around contraception and sterilization. And but those are not simply historical, right? We can't say, oh, in the 70s, Mexican immigrant women were coerced into accepting sterilization. And because we know about that, it's giving us insight into how we should behave today. That's not really the way to look at it. What we know is that throughout the history of the United States, Black women, Indigenous women, immigrant women, disabled women living with disabilities have been subject to coercion and in some cases forced use of contraception and sterilization. And when you look at the fact that we are now providing healthcare in a system that was built on the belief that for some people, they can't be trusted with decisions about their body, that helps us understand why total bans on abortion are being accepted today and being advanced in the United States, right? The underlying belief that some people, some human beings who may become pregnant or who are pregnant do not have the same level of humanity, dignity, and right to make a decision about whether or not they should become pregnant. That's a through line, right? You can't simply separate it out. And that's also what we kind of try to highlight in the paper. Contemporary public health, social science, and medical research have shown that the experience of Black women, immigrant women, Latino women at the clinical encounter, today in recent times also includes being given advice, being encouraged, being directed towards either not becoming pregnant or certain types of contraception. And based on really a system of organizing society in which social problems are conceived of as being really born of Black and brown women, right? And clinicians are not exempt from those embedded beliefs because they were also born and raised in the same society. And we have to highlight those realities if we want to understand what it would take to protect and advance abortion rights, because all reproductive coercion in this country, and writers and scholars like Dorothy Roberts have said this, all reproductive coercion has to be seen from the lens of wanting to advance white supremacy, not just misogyny and sexism. If you only see reproductive coercion as a function of gender oppression, you will absolutely fail to comprehend and therefore address the way that reproductive coercion works in this country, right? Certainly, white women in many ways are collateral damage of policies, both informal and formal, to control the reproduction of Black and brown bodies. And white women are subject to coercion based on their whiteness, right? We hear about white women being denied sterilization, for example. Maybe they'll regret it. That bigger picture is the foundation for understanding why we have abortion restrictions and abortion bans, and why they fundamentally, people have stickers now, oh, abortion bans are racist. It's a soundbite that makes sense to people who sort of live the racism of abortion bans. But for someone who thinks, oh, abortion's, not about race, abortion's, about pregnancy, you have to understand the history of this country and the ways that reproductive coercion are actually a tool of maintaining white supremacy if you want to understand the motivation behind things like abortion bans and also the effect that they'll have on communities.
Oh yeah, that's like the most perfect segue ever into the inequitable effects of abortion restrictions. You really talked about the abortion bans or racist campaigns and like trying to get people to understand that point. So let's dig into a little bit about how there are inequitable impacts that we are seeing.
I think now we're at like 12 states have banned abortion outright completely. Another couple have banned abortion at 6 weeks pregnancy, or more or less at 6 weeks pregnancy, which is before many people know that they're pregnant. And I'll just note before I talk about the inequitable effects, just the immediate landscape is that almost 70 abortion clinics in this country have closed in the past 6 months. We calculated in the first 100 days after the Dobbs decision that overturned Roe, 66 abortion clinics closed in this country. So we have thousands of women in this country, thousands of trans men, non-binary people, anyone who could become pregnant are now in a position where they either need to spend thousands of dollars if they have it to leave their state. They need to, or if they cannot do that, they can try to still obtain an abortion where they live by self-managing their abortion, or they can continue their pregnancy. We have to start with that is the option. That is the scenario here, right? And for some states where abortion is banned, we're talking about traveling hundreds of miles, right? Think about living in the middle of Texas, the middle of Mississippi, states where every other single state around you has also banned abortion, right? This isn't about going over to the next state or crossing a state line. This is traveling across multiple states, right? That takes, number one and foremost, time and money, right? In this country, we have a network of abortion funds and practical support networks that are doing unfathomably effective and heroic work, connecting people to resources to be able to travel. And in fact, have been doing that for a few dozen years. Obviously, they've had to scale up. And so their existence has maybe mitigated the impact for some people, but we're talking about the entire population of entire states having no abortion access. They're not going to be able to meet the needs of every single person. So that's the scenario. Then we can talk about the inequitable effects, right? Who is going to be able to still get an abortion in those scenarios? We're talking about people who have the most amount of resources, right? A lot of, high incomes, and not just a high income. Many people with jobs are still living paycheck to paycheck, right? We're talking about having access to the types of resources that really only the most resource people have. We're talking about credit cards. We're talking about savings accounts. We're talking about people in your life that can also have access to that kind of money and lend it to you. We're talking about time, right? If you live in Texas and you have to go across 2 or 3 states, we may be talking about 2 days, 3 days, 4 days, a week, 2 weeks, where your life is on hold because you have to travel, stay overnight somewhere. And then what? Find someone to keep your kids, right? The alternative in a world where abortion is a normal part of everyday healthcare is maybe you have an appointment for an abortion, you need a babysitter to watch your kids for an afternoon. That's appropriate. We're talking about finding someone to watch your kids for a week. There are very few people in this country who have somebody in their life who can drop everything and watch their kids for a week, right? We're talking about an extraordinary amount of resources that it takes. So right there, the inequitable effect is that really, wealthy people are going to be able to still get abortions, and people are living paycheck to paycheck, struggling to make ends meet, or frankly, are just regular middle class people at this point, right? Because we're talking potentially thousands of dollars. So we're already talking about the difference between someone being able to get a timely abortion care and someone who's going to be severely delayed, therefore have to have an abortion later, which then costs more money. And even though abortion is incredibly safe, safer than childbirth at any stage, still being delayed and having an abortion is not high quality care. There's still added risk the further along you are. And frankly, why do we live in a place where people are forced to be pregnant longer than they have to, right? And then the question is not just around who has money, but what are the social, identities, the systems of oppression along which that money is distributed? It's along race, class, age. So young people, people who are under 18, and people living with disabilities, immigrants, people who are already living in a world where they're not being paid what they're worth for their work, who find discrimination in the healthcare system on the day-to-day basis anyway, and may have fewer resources to be able to connect up to the types of transportation appointments that it takes to get that appointment right. And so what we're going to see is, and for anyone listening who already is working in abortion funding, who's already working in reproductive health in these states, you're already seeing it, right? People for whom even before Roe, abortion was difficult to obtain are going to be even more delayed, and more people are going to be forced to continue their pregnancies. And for people for whom before Roe was overturned, they were barely able to get the abortion they needed, now it's going to be out of reach, right? So there's more people for whom this is going to be a problem. And, this might be something that you might get at in your next question, but, what does that mean for somebody for whom now abortion is simply out of reach? The resources aren't there. The money's not there. The social support is not there. The time off of work, someone keeping your kids. What are their options? Their options are that they'll be forced to continue a pregnancy that they don't want, that they've made the decision is not the right choice for them at this time. Or they might think about self-managing their abortion. And in most states, technically, self-managing an abortion is not illegal. It's very safe to self-manage an abortion with misoprostol or with mifepristone and misoprostol. But as people who, if people who are choosing to self-manage their abortion are doing so because they don't have the incredible amount of resources it takes to leave their state, they may be more likely to be targeted for involvement with law enforcement because they don't have as many resources to deal with law enforcement, right? So it's a perpetuating cycle where we really are having two worlds for abortion. I mean, it's always been that way in the United States, and now it's even worse.
Yeah, it just feels like it's magnified by so many degrees where it's just so much starker that I think, if you worked in repro or worked in abortion, they were inequities you saw and knew and understood. And now it's just like on such a larger scale that it feels like the broader world is starting to pay more attention than they were before when it was just like a repro conversation. Now it feels like it's getting bigger. Or maybe that's my bubble of I'm like in all the repro threads and streams and whatever, but it feels like it's getting talked about in a different way, which is just like a great kudos to like all the repro justice advocates who have been doing the work to make those stories louder.
I completely agree. I mean, there's two sides to that. And the one side that you're talking about is for people for whom it, Dobbs maybe sounded the alarm in a way that, all the decades of attacks on abortion before didn't. It's really reproductive justice organizers and advocates who have been doing these decades of work so that when those people for whom June 2022 was like the, oh crap moment, that when they went to go look for stories, resources for understanding of the issue, those materials and resources and narratives were there. That's invaluable and incredibly important, right? And that's organizing, right? Meet people where they're at and then bring them in as you can. And because of the reproductive justice movement, we've been able to do that. I will say though, on the sort of to try to understand how we got here a little bit, is that sort of incremental worsening, I guess, that you talked about. It's on purpose, right? We go back to the Hyde Amendment, which is famously talked about really as the first, post-Roe abortion restriction. The Hyde Amendment is added every single year into the U.S. budget. And it's it was a bipartisan effort up until Joe Biden ran for president, right? Everyone agreed that was going to be the status quo, that we were going to have a national law saying that people who are entitled to Medicaid, whose health insurance is Medicaid, can't use their health insurance to cover abortion, right? So abortion's a right under the Constitution, but it doesn't have to be realized, right? Because we're taking away your health insurance from you. My colleague, Heather Boonstra, wrote about this over a dozen years ago in an article where she highlights how we get to a place where all of a sudden people who didn't think that abortion was their issue are really alarmed because their rights are being threatened, right? Abortion's now banned in their state. Well, Henry Hyde said when he proposed his Hyde Amendment that he would like, if he could, to stop anybody from having an abortion. But unfortunately, or fortunately, targeting poor women through the Hyde Amendment was the only vehicle that he had at the moment, right? The very first abortion restriction at post-Roe was targeting people who had the least amount of resources and the least amount of political capital to fight for their rights. And every single abortion restriction since then has followed that same path, right? Until the antis have built the political will among elected officials to make it seem reasonable to then just go for the whole thing, right? Thinking about, Indiana, the first state to pass an abortion ban after Dobbs, their Supreme Court heard arguments a few days ago about whether or not, abortion was protected by the Constitution. That didn't happen overnight. Indiana has been drastically, severely advancing multiple abortion restrictions that are medically unnecessary and completely draconian for decades, right? And each one seems a little bit reasonable because it kind of is like, oh, we don't want taxpayer funding for abortion. We don't want abortion that's too far along in pregnancy. We don't want like young people to get an abortion. All of these carve outs that make it palatable for people to accept. And the ultimate one that we're seeing now is these exceptions to abortion bans that in the United States, I want to acknowledge that exceptions to abortion bans have two sides, right? In Latin America, we've seen these exceptions be used to advance abortion rights. So in countries where abortion was completely banned, introducing exceptions to bans like life and health of the pregnant person have actually been tools to expand abortion rights. But in the United States, it's the opposite. Exceptions in abortion bans like life, health of the mother, and all of those sorts of things are used to make abortion bans politically palatable. And we have no evidence that they're used in real life, right? The New York Times wrote about this last week, but there's been, articles about this for a couple of decades, that what it takes to actually get your abortion covered by your Medicaid if you've been raped, what it actually takes to get an abortion if your life is in danger, in practice is nothing short of heroic and many times impossible. And so this idea that now people are becoming more aware that abortion is like a bans on abortion fundamentally put at risk the health and life of pregnant people and really place into question anybody's right in this country to be able to care for themselves in the way that they think is best, is been possible and predicated on the idea that for some people in some circumstances, it's not as important for them to be able to decide to get an abortion.
I think the other tool they were really effective at for a really long time was introducing what was a wild way out there ban, which is now our reality, but like whatever, like quote unquote heartbeat bans, the like 6 week bans, and like outrage would come in from all quarters, and they were like, okay, we didn't pass that bill, and then quietly slip through a 20-week ban or a 72-hour waiting
Yep.
period. And then you wouldn't really hear much about that because they didn't do the like wild out there one. They did like the reasonable.
That is absolutely the story. I mean, some of my colleagues worked on, some of the early the heartbeat bills from like 10, 12 years ago. And at the time, they were framed as sort of being completely absurd, that even the antis couldn't
Mhm.
agree on it because they were right.
Nope,
They
didn't
couldn't
agree.
agree on it. That was sort of the right flank strategy. Then introducing a 20-week ban seemed pretty reasonable, right? And one thing I'll highlight is that a vision for what it means to be able, as a person who could become pregnant, to really decide, if I want to be pregnant, if I want to continue my pregnancy, if I want to parent, really centers my health and well-being, the health and well-being of people who could become pregnant. The only way to get there is through a reproductive justice practice and framework and understanding of the world, right? Because from a reproductive justice perspective, none of this is reasonable, right? Both because two things. One, if we understand that power is central to what it means to restrict, control, coerce, and decide whether or not to become pregnant, how I want to move through this world and my gender, that's about power at the social level, right? It's about maintaining white supremacy and the patriarchy. If you fundamentally understand that reproductive coercion and restrictions are in service of that, then there is no reasonable ban. There is no reasonable carve out because they all serve the same purpose, right? Which is to advance oppression and take away the dignity and humanity of people who aren't white men, frankly, right? If you want to debate abortion on these intangible terms, that frankly should not be legal issues, right? Whether how comfortable people are with abortion, whether they think it's right or wrong. People have many diverse views on that. But when we're talking about what should be the law, like what are we going to punish people for? What are we going to allow people to be in community, build the families that they want? None of that really comes into play because the data are there and people's lived experiences speak for themselves. But the debate, I don't even know if it's a debate. I'm a scientist, but the justifications, I will say, upon which we got to Dobbs have fundamentally left out the human beings whose lives are at stake. And in fact, if anyone wants to go back and look at the arguments in the Dobbs decision, the amount of time spent talking about the
Yeah.
desires, health, safety, humanity of pregnant people is minuscule, almost none, except for when Amy Coney Barrett talked about how safe haven laws take away the burden of parenting was really such an impoverished conversation when we think about what it means to be a pregnant person in this country, especially if you're Black, brown, or an immigrant.
Okay. That's all really, really heavy, and it's all really
Yeah.
heavy right now. So maybe let's talk a little bit about some of the things that have been happening to protect abortion access post Roe. Because there are, I mean, again, everything is terrible and it feels really terrible, but there are some like little bright might be a big word. There are little spots of light of things being done.
Yeah, things are heavy because banning abortion is completely retrograde. But I will put into context this that was the plan all along, right? The movement to decimate abortion access has always planned to ban abortion, and they plan to keep doing it. Even they want to introduce a national law to ban abortion. So
Yeah.
while grim, this is something that has been well documented, and that's their goal. something that will help us continue to organize, continue to move towards justice, continue to lead with love and human dignity, is knowing that that's actually their goal. And there is no common ground except at all. There's no common ground, right? That the goal is to ban abortion completely, to the extent of putting people in jail. So if you accept that that's the case and that they will not stop until we get there, then we can back out and say, where are we really building the communities and the political will, the understanding that doesn't allow that to happen, right? That's how I feel about it. And we have so many great examples. First of all, many state governments and governors and legislatures have stepped up. Again, because in the decades before Dobbs came along, organizers at the state level have been talking about protecting abortion rights in their state constitution for a very long time, right? This wasn't just a brilliant idea that popped up because of Dobbs. People have been doing this. People have been writing these bills and trying to introduce them for a very long time. And we've seen so many states now really step up and protect abortion rights at the constitutional level. I don't even think I know what they all are. Certainly, we're talking about Connecticut, New York, Illinois, Oregon. And even in some of those states like New York, people are saying, okay, that first go around was great. We can take it further, right? We can really, revisit even the protections we have and make them even stronger. For people at the state level who are organizing around these things, Minnesota, they brought a case to their Supreme Court. Every single abortion restriction was overturned because a judge said, this is not protected in our Constitution. And now they're trying to codify it by introducing an actual law. And this is incredible and super important. I also want to highlight that people are protecting reproductive health rights and justice at the even at the community level, right? We've seen states, we've seen cities and counties, including in Texas, say, okay, in this town, we are going to carve out a budget for people to be able to access abortion, whether it be for transportation or an abortion fund. And then something that I, have been thinking about for a long time, and I wrote a paper with some colleagues from UCSF about this, is that abortion is healthcare. Yes, we know that abortion is central to reproductive justice. But abortion is also central to public health, right? I'm a trained public health scientist and professional. And the idea that abortion is not considered a central public health service is not based in evidence. And, we advocated that departments of health should be providing abortion care, just like they provide STI testing and treatment in many places, and some, pregnancy testing, in some cases, prenatal care. And in fact, public health started out with helping pregnant women, over 100 years ago in this country. And now we see that New York City Department of Health and Mental Hygiene has started providing medication abortion for free as part of their services. And that's amazing. I think that should be considered pioneering leader that other departments of health can look to be able to ensure that they're delivering the full spectrum of public health services. But they're a leader in the fact that they actually did it. The sort of the evidence and the framework for saying, should public health departments be providing abortion has been there for a very long time. So all that is really exciting. And I think, for people who are feeling like, geez, I can't influence the Supreme Court, right? Can you really even influence the Supreme Court in your state, except for potentially, signing some things. But as an individual, it can feel very overwhelming. But it's very likely that in your community, people are thinking of really creative ways that center the humanity of pregnant people to be able to ensure that abortion access is there to the extent possible.
And then just as a Wisconsinite, I will throw in, there is a Supreme Court justice election in Wisconsin in April. So there is something you can do and you can
That's
still
amazing.
vote. So make sure to vote in April for a Supreme Court justice, which in Wisconsin is huge for abortion access right now. So make sure there are still opportunities to make change.
That's incredible.
I can't remember the exact date though. So
you
sorry, y'all.
Can put it on the website. Yeah. I mean,
yeah.
I just read that, not to this is not me parroting, a very, soulless talking point of the Biden administration, right? Like, obviously, what politicians decide to do about abortion access is not my expertise. I'm a researcher and I evaluate the policies and people's experiences with abortion. But one thing I've noticed just as a citizen is that because of where we're at, people are running on this platform. Indiana, a place like we just said, where the very right to an abortion is in play, is, people are jumping in their race for senator, and they're talking about abortion as central to what their vision is for the state. And so, for better or for worse, depending on how empowered people feel, voting is actually going to matter in your communities. And that Wisconsin is an important example.
Okay, well, I could absolutely talk to you forever, and this has been really fascinating. We should probably wrap it up so I can be cognizant of your time. But we always like to ask, what can our audience do? We talked about one, you can vote in Wisconsin still, but what can our audience do right now?
I say this every single time because it is so immediate and so tangible, is you can donate to an abortion fund. Abortion funds and practical support networks, which are organizations that help arrange people's transportation, are really making abortion access real in this country right now, really real. And amazing things are happening because the reproductive justice movement in particular has never faltered from its vision. And then you have like Guttmacher Institute, which can bring the data and the facts if you need them. And, people do need them. But there's the sort of the bigger picture of like, what's the 10, 20, 30 or 100-year vision? It's abortion access for anyone who needs it, in a timely manner, for free, ideally. But we know that today, literally today, somebody is struggling to access abortion care because abortion is banned in their state, or there's tremendous restrictions. And every single time you donate to an abortion fund, you're making abortion access real for somebody. So you can go to nnaf.org and you can actually just search your state. You can donate to an abortion fund where you live. You can donate to an abortion fund, where your best friend lives. If they live in another state, you can donate in their name. It's really a really important way for people to come together and help each other, right? It's mutual aid. It's not charity. It's really building power around abortion access.
Yes, and a lot of abortion funds have really amazing merch you can buy. I'm actually wearing one right now from, I can't remember where. Sorry, y'all. I think it's from maybe the Tea Fund in Texas. I feel like, don't quote me on that.
Merch is amazing, but if you have a t-shirt or a fanny pack or a mug, you're also taking part in shifting the culture around abortion and saying the word abortion. The idea that abortion is sort of should be rare, or that it's an unfortunate thing that's necessary. Saying that you're pro-choice or celebrating Roe without talking about abortion. I think that the analyses that a lot of reproductive justice advocates have brought around why that's problematic deserves to be really heard out, right? Certainly, I'm not a comms professional. We can tailor our messages to people so that we can meet them where they're at, try to understand what about this issue matters to them. But avoiding the term for that reason, when really what we can be doing is normalizing abortion, right? At Guttmacher Institute, my colleague Rachel Jones, who's the principal investigator of a lot of our abortion work, she's updated these data for a long time. 1 in 4 women in this country will have an abortion in their lifetime. And we say women because we use census data, but it's a proxy for anyone who could become pregnant. Abortion is super normal, right? 60% of people having abortions have already given birth. And for many people, their experience with abortion and their story is a super important part of, how they came to become a parent, how they came to understand what their values are, how they relate to their partner and their families. And I just really think that, like, when you buy abortion merch, you're drinking out of your abortion mug, you're wearing your abortion shirt, you're deciding what you want the culture and values to be where you live, among the people that you care about, and in the country that you live in, which is that abortion is a really important and in many ways wonderful part of being able to take care of ourselves.
Well, that is the perfect place to stop. Liza, thank you so much for being here today. I had so much fun talking to you about really important but terrible topics.
That's a good way to put it. Well, thank you so much for having me, Jenny. And I know I talked a lot, but there's just so much really, there's so many important ways to relate and think about abortion beyond, just the headlines. And I really appreciate you giving us a chance to go there.
Okay, y'all. I hope you enjoyed my conversation with Liza. I had a wonderful time talking to her. I could have talked to her for hours. It was so wonderful. Let's see. If you have any questions or if you have a topic you'd like us to cover, always feel free to reach out. You can find us on social media at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. Or you can always shoot me an email. I'm at Jenny, JENNIE, at rePROsFightBack.com. Anytime. I'm always happy to take questions. Always appreciative of any feedback. And with that, I will see you all in 2 weeks. Bye. For more information, including show notes from this episode and previous episodes, please visit us at our website at rePROsFightBack.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.